Here again with an update on COVID in Bristol and everything we're doing to try and support you and keep you safe. So our background infection rate continues to fall. We're now at 201 cases per 100,000 people over the last 7 days. That is roughly the same rate as the England average now. It's 282 patients remain severely unwell with COVID-19 in our hospital beds across the region. But as I say, we're going in the right direction, but it's still a challenge. 200 is still high. And we can all continue to do our bit to support the NHS by following the guidance. No mixing socially with people not in our households. Keep washing our hands, wearing face coverings, keep 2 meters apart, and stay at home whenever you can. Use the NHS 111 line before visiting A&E, unless it is a serious or life-threatening emergency. And throughout this pandemic, NHS staff have been there providing urgent and appropriate care. Please remember that, it's a huge debt of gratitude we have to them. And along with critical workers across Bristol, they've witnessed firsthand the impact this virus is having. Some of those workers in Bristol and the Southwest want to share their stories from the front line. So working with the NHS, the Clinical Commissioning Group, Sirona, Bristol Hospitals and the police, we're telling these stories now. You can visit the Healthier Together website to hear those stories and the advice on offer. Okay, so that is together.org.uk/COVID stories. Together.org.uk/COVID stories. Now, you'll know that there's surge testing going on in Bristol at the moment. Testing is being offered to people in 24 postcodes, and you can find those postcodes on our City Council website. Now, the aim of the testing is to help better understand the changes that are occurring in the virus. That work will be fed back into the laboratories as well to make sure that the vaccines remain effective. There are 14 confirmed cases in the area of the Kent variant of the virus that public health scientists are now looking for. The more we test, the more cases we expect to find. This finding is of concern, but it's not of alarm. This changes in the virus are what the virologists expect to happen. The viruses are very unstable in their early stages. The guidance remains the same to everyone, and the national lockdown rules still apply. Thank you to the thousands of you who've already taken part in this surge testing. Over 15,000 COVID-19 tests have been carried out or collected for home testing since Sunday. So just over a week remains to get a test. You can have a test if you were over 16, have no COVID-19 symptoms, live in one of 24 postcode areas that are listed on the bristol.gov.uk website. You can also get a test if you travel into these postcodes for work or to support someone in your bubble. So there are 6 mobile testing units across Bristol and South Gloucestershire. They're open Monday to Sunday, 9 a.m. to 6 p.m. And you do not need an appointment. There are also a number of collect and drop sites, and you can collect a test kit and return it when done. These are open Monday to Saturday, 9 a.m. to 4 p.m. And if you're visiting a collect and drop site, please register your test at home as soon as you can and return it as soon as as soon as possible, ideally the same day. And you can visit our council website again for details of when you can find these sites in libraries across the city. You do not need an appointment, and you can ask someone to collect a test for you. Now, our health partners continue to do an incredible job of rolling out the vaccine. Nearly 191,000 vaccines have been administered across Bristol, North Somerset and South Gloucestershire. Appointments are currently available for people who haven't yet been vaccinated against COVID-19 and who are over the age of 70, clinically extremely vulnerable of any age. And this means you've received a letter at some point asking you to shield due to a health condition. If you're in one of those groups, you no longer need to wait to receive an invitation letter. For an appointment at a doctor's surgery close to where you live, call your local GP practice to discuss your options or visit their website. And to book an appointment at Ashton Gate Stadium or one of the pharmacy locations, use the national booking system. And that is www.nhs.uk/conditions/coronavirus-COVID-19. So I know that's along email, but just go on the NHS website and find your way through. Now, the pandemic continues to place the spotlight on mental health and well-being, particularly for children and young people. And on Wednesday, the 17th of February, as part of the Are You OK campaign, young people from the Keeping Bristol Safe Partnership are running a free online mental health and wellbeing workshop. And this will give children, young people and professionals an opportunity to come together to talk about the effects of the pandemic on mental health and the support services that are available. So it will feature a variety of talks and presentations from local experts and young people's groups, including Listening Partnership, Wessel's Forum for Young Disabled People, or with young people with learning difficulties, Unity, Bristol's Young Black, Asian and Ethnic Minorities Community Group. So the workshop takes place next Wednesday, that is February the 17th, at 10 a.m. to 2:30 p.m. on Zoom. And you can find a link on the main Bristol City Council website. So please stay safe.